Hello, fellow student nurse. What are you doing?
I am about to give regular insulin.
You are about to give regular insulin?
I am about to give regular insulin.
You are about to give regular insulin that is cloudy.
I am about to give regular insulin that is cloudy.
You do know that regular insulin is not supposed to be cloudy.
I do know that regular insulin is not supposed to be cloudy. Oh. Maybe I should recheck the 5 rights.
Medication reconciliation is the process of comparing a patient's list of drugs presently taken with those listed in their record or prescribed orders. In the book Patient Safety and Quality, Barnsteiner points out that more than 40% of medication errors occur due to poor reconciliation. Thus, medication reconciliation is a significant public health issue as we seek to prevent injury in that portion of the population that takes medicine. This should be an ongoing concern of both professionals and consumers. Compare the patient's prescriptions to the medications that the patient has actually been taking. Avoid medication errors including omissions, duplications, dosing errors, drug-drug interactions, or drug-disease interactions. Repeat at every transition of care in which new medications are ordered or existing orders are rewritten. Transitions in care include changes in setting, service, practitioner, or level of care. Here are 5 steps to follow. Number 1. Develop a list of current medications, including over-the-counter drugs. 2. Develop a list of medications to be prescribed. 3. Compare the medications on the 2 lists. 4. Make clinical decisions based on the comparison. And 5. Communicate the new list to appropriate caregivers and to the Healthy People 2020, available at healthypeople.gov, is the latest update of the initiatives for national health promotion and disease prevention, which grew out of the 1979 Surgeon General's report. It sets objectives and benchmarks and includes goals that directly address the issue of medication reconciliation. The medical product safety objectives for 2020 include promoting better health for Americans through the appropriate use of drugs. Proper reconciliation strengthens these objectives by supporting the safe use and close monitoring of medications. Public health nurses can be effective in promoting medication reconciliation through public health interventions. The Minnesota Department of Public Health described public health nursing as a synthesis of the art and science of public health and nursing. Thus, public health nurses use strategies from both in their professional practice. No matter the setting in which they work, all public health nurses use a foundational set of interventions. This intervention model, the intervention wheel, identifies public health nurse practice by level of practice and type of intervention rather than by location of service. The inner wheel here illustrates 3 levels of practice: individuals and families that make up communities, and the systems that impact communities. The actions which public health nurses undertake are arranged around the outer edge of the wheel, representing 17 public health interventions. Many of these interventions may be applicable in our efforts to improve medication reconciliation, and one obvious action is that of health teaching. From the Minnesota Department of Health, health teaching seeks to influence knowledge, attitudes, values, beliefs, behaviors, practices, and skills. It can be applied across all levels of practice. Specifically, the importance of medication reconciliation can be taught are retaught at every level and at multiple points of contact. Points of contact are those opportunities that we have to perform medication reconciliation and include any combination of hospitals, clinics, doctors and dentists' offices, pharmacies, long-term care facilities, schools, places of worship, prisons and jails, and within private homes. In Healthy People 2020, the U.S. Department of Health and Human Services supports the use of health information technology, including electronic medical records, digital prescribing, and decision support software. They recognize that widespread use of these tools should help to reduce medication errors, improve communication, empower consumers, and enhance surveillance to identify adverse effects. Meanwhile, the AMA Center for Patient Safety offers other tools that may be more easily adapted for immediate use at very low cost, including a downloadable checklist, a card which a patient can carry, and yes, there is an app for that. Prior to implementing any new program, we need to include considerations for HIPAA compliance, cultural concerns concerning privacy or expectations of patient professional roles, and keep in mind barriers such as cost to rolling out a new program, as well as perceived or actual workload of current healthcare providers. Given the potential harm medication errors can inflict and the scientific support for safe use of medical products, it should be clear that medication reconciliation is a public health issue worthy of our active support.